Welcome back to another episode of the Mom and Mind podcast, and also welcome to Maternal Mental Health Month and Mental Health Month in general. May is a really important month for us to be raising awareness and to be continuing our conversation about difficult topics, breaking stigma, understanding how mental health impacts us, and learning how we can cope and get through these sometimes really difficult mental health conditions. And maternal mental health needs a huge spotlight on it because for far too long it's gone under recognized, underdiagnosed, and too many people have suffered for way too long. We're going to talk to Karen Kleiman today, who has extensive experience in perinatal mental health, but also can see the long view about how far we've come and how far we still need to go. Karen is a well known international maternal mental health expert with over 35 years of experience. She is an advocate and author of several groundbreaking books on postpartum depression and anxiety. Her work has been featured on the internet and within the mental health community for decades. In 1988, Karen founded the Postpartum Stress Center. And in 2022, she founded the Karen Kleiman Training Center, which is dedicated to the advancement of clinical expertise and therapeutic strategies for the treatment of perinatal mood and anxiety disorders. And all of the advanced trainings are heavily influenced by the Art of Holding Perinatal Women in Distress model of intervention created by Karen Kleiman. And I'm excited to have Karen on today because we are going to be talking about intrusive thoughts and how difficult it can be to differentiate sometimes between what is a really common and normal level of intrusive thoughts to what is more concerning, what might need more intervention or support or help. And then how can you differentiate between those? It's really important that all of us have accessible, usable tools in our toolbox so that we can get the help that we need. And Karen gives a really good perspective on how to understand what's common and normal versus when you might need that help. So let's get into it and hear from Karen. Welcome, Karen. I'm really excited that you're here with us again. It's been a minute since you were on the last time, way, way early on when this all started. But so many people have been impacted by your work in such a positive way. And the books that you've put out, I know personally my clients have benefited from it. So yeah, thanks for all that you do. Thanks for being here.
Course. It's been too long. It's been
It
too long since we
it
spoke
has
with
been
that.
too long. We should have a regular podcast date.
Huh?
Have you
Well,
on.
I think the first time was like 100 years ago at PSI, right?
I feel like that. Yes.
Yeah,
Yeah.
in person. Yeah,
Oh,
when
Philadelphia?
when life was, yeah, maybe it was Philadelphia.
Hmm.
Maybe it was. Yeah.
Yeah, forever ago. Um,
hmm
right. But since then, you've put out more and more books. How many books are you up to? Do you know the count?
I think it's 14.
That's amazing. I managed to squeeze out one little book with a lot of help and
A
support.
really
And
good book.
I think, like, when I think about how much you've written, I'm just in awe because it takes, for me anyways, it took a lot of effort and it just seems to just pour out of you. Maybe that's my perspective, but
It's yeah, as you know, it's a lot of work, but it's also when it's passion driven, it's sort of like, like I sit at the computer for 7 hours and it's like, whoa, I sat here all day, and it sort of just comes. But it's a lot of work. It's a lot of good feeling. It's sort of like having a baby.
you have a lot of book babies
I
out
love
there.
book babies. It drives you crazy and you love it, and all,
Hmm.
all the emotions come out at once.
Hmm.
Yeah.
Yeah, but I do think it takes, not everybody can write as many books as you have, and have as much of impact as you've had just by being able to put all of that into somebody's hands in their home. For therapists, both therapists and people who are suffering through perinatal mental health stuff, it's just so accessible. Even when people can't get to a therapist or get to the help that they need, they can get to a book, and you have so many to offer.
Yeah, thanks for that. But more than just the books itself, I feel like I have a voice that works because I don't write like an academic person or even a grown up for that matter. Many of my books are very chatty and very, it's as if I'm talking to you. And the
Mhm,
first book, this isn't what I expected. I remember, I always say I learned everything I know from the moms who trusted me to talk to me, because there
mhm,
weren't trainings then and there weren't
mhm,
books then and there weren't
mhm,
places to go to get this information. And so um, I noticed that I was sort of saying the same thing to everybody and hearing stories that sort of were similar and different and narratives that were very personal but overlapping. And
mhm,
I thought, I need something to say here. Here's what's going on. Here's what you need. Here's what,
mhm,
let me put it down. Once we name something, once we identify it as a real thing, it just feels much more um, controllable. And
mhm,
so that's when I connected with my then sister-in-law, Valerie Raskin Davis. And I said, you want to help me with this? And she's like, yeah, let's do it. So she really motivated me to get the first book out. And that was really what jump started my passion. And by the way, for everybody who doesn't know what they want to do in their life, my first book was written when I was in my early 40s. So that's when I really realized, how much I love the process itself and the opportunity, like you said, to get in the hands of moms who
mhm,
are suffering, to give them some information and to empower them with what does this mean? What do I do? How can I
mhm,
feel better? How can I
mhm.
take care of it myself in case I can't get anyplace for help?
Right. And with your more recent books, I guess, or a couple of them, Good Moms Have Scary Thoughts, and now What About Us? It's so, it's just even more accessible. There's something about the images
Mm-hmm,
in those books paired
mm-hmm,
with like the real internal thoughts that
mm-hmm,
people have
mm-hmm,
that it breaks through so much
mm-hmm.
stuff. Like you can't not see yourself in it if you're going through it.
Now there is a little magic in this book,
Mhm.
and um, Molly McIntyre, who's the artist of the illustrations, she and I really connected in a way that with my words and her very authentic and relatable drawings, um, there's just something that, like you said, somebody can pick this up and go, I mean, she can be diagnosed with full blown depression, or she can just be overwhelmed. She could just be a new mom that's looking for support, and everybody can find something in there. And it actually, out of all my books, felt like the very first and most powerful one to precisely to your point, that it was to say, if I can't get any help anywhere else, if I'm locked in my house for a week or so, I can get help here.
Mhm.
And there's, the expert guidance along with the journal prompting, along with the relatable comics. And so it feels like in this cute little package, the publisher Familius did a great job of marketing it. Just like, look how sweet this little book is. There's so much in there for
Right.
her to take and learn from and take care of her own mental health and to not feel so isolated and misunderstood. So
Mhm.
I'm really excited about getting that book into every mom's hands. I really am. It's really and it's taken off in that way. And again, it's never about selling books. It's about empowering moms to take care of themselves, and they're getting so much better at it. They are.
Right. Are you really seeing that? Are you seeing the kind of growth in?
I am seeing moms getting better at asking for help, let's say, and
Mhm.
getting better at saying there's something not right. But
Mhm.
at the same time, we're seeing more and more women suffering, and we're seeing,
Yeah.
less and less support. And so it doesn't all balance out. You know what I
Mhm.
mean?
Mhm.
While we have a couple women who are better at asking for help, we've got 10 more who are sitting at home alone without help and without
Mhm.
social support and so forth.
Mhm.
So we're taking baby steps in the
Right.
right direction. But sometimes, you've known me a long time. Sometimes I get, be careful how I say this, but I get a little exasperated, like I've
Mhm.
been saying the same thing for almost 4 decades.
Mhm.
Why aren't there bigger changes? Why isn't the medical community asking the right questions? Why are so
Right.
many women still suffering? Why do we still have a stigma about this? Why do we? Why do we? Why
Mhm.
do we? Why? So
Mhm.
I could just
Mhm.
go on and on. And the flip side of it is we've got social media now with this loud collective, voice, hear me roar, and that's not always good either. So there's
Right.
a downside to that. There's an upside to that. It gets a little complicated. We don't want to miss women who are quietly suffering by themselves. We
Mm.
don't want to over normalize women who are hmm, giving out misinformation about perinatal mood and anxiety disorders.
Mm.
We can't
Mhm.
possibly monitor what everybody's doing and who's asking for what. So
Right.
it's about as chaotic as everything else is. But we want to grab my passion has always just been, is the woman sitting in front of me okay? Right.
Mhm.
So other people do the advocacy, other people do the research, other people do the, standing on, at Congress and making, legislative changes. And I just want to make sure if you come into my office or if you're sitting in front of me, that you're okay when you leave.
Mhm. Mhm.
And so sort of like down in the trenches,
Yeah.
and we've learned a lot. We've learned a lot. We've come very, very far in many ways. And like I just said, in many ways we haven't.
Yeah. Yeah. Well, there's a couple of avenues that I wanted to go down as you were talking about all of that. I think we could maybe spend a whole episode on misinformation that's out there, specifically
Mhm.
on social media. That's tough. It's tough to see. I'm sure it's
Mhm.
hard for you to see as somebody who's
Mhm.
been doing this for a while, that, some of the stuff that's out there just isn't accurate, is
Mhm.
potentially harmful.
Mhm.
But yeah, I
Mhm.
think that would require some
You
in-depth
know, I
conversation.
really, really, yeah, and we won't go down there. But I do want to say that I feel especially qualified to have this conversation because my daughter had a baby had two pandemic babies,
Mm,
and so I got that vantage point of seeing a new mother um, emerge with
mhm,
very little support, with me sitting here behind a mask going, "His woman's
mhm,
over," I mean, it was
mhm.
just horrible for both of us. She literally gave birth to her first the day before the world shut down.
Oh my gosh.
So I just watch it, and I see her scrolling and getting information, and she's smart, and she checks with me for
Mhm.
everything. Is this
Right.
good? Is this not good? Is this
Right.
okay? You
Right.
know, but I see, and I'm like, you know what, babe, don't, because just you just have to be, you have to have good, you have to have good instincts. You have
Mhm.
to have good support. You have to know what you're reading, what you're exposing yourself to. So you can
Right.
feel good, and then in a second it just flips on you, and you
Mhm.
get exposed to something that your brain can't let go of, and now you're just ruminating about that, and it's
Sure.
wrong.
Sure. Sure. Right. Um, yeah. Well, speaking of, your brain not being able to let go of things, some of the things that we're going to talk about today are intrusive thoughts. And, of course, your book, Good Moms Have Scary Thoughts, goes into a lot of that. Um, and I hear it a lot. And I think from what I've experienced just sitting with people, the pandemic really made things a lot worse, in terms of just general fear out there, things to be worried about, but then fuel to the kind of intrusive thoughts fire.
That's the problem. The pandemic, we always defined intrusive thoughts as, as random thoughts that sort of come out of nowhere by definition, and bombard us with anxiety. And then when the pandemic came, which I don't feel particularly qualified to spend too much time talking about it, because it was so emotional for us as a family, but everything became real.
Mhm.
My daughter, who has OCD, who grew up with OCD before the pandemic, in some ways it flipped for her. Like, she sort of felt good. She felt safe. She
Mhm.
felt clean. Everything was, she's sanitizing everything. This is what she spent her whole life doing. And now everybody was doing it. So her
Mhm.
anxiety did not get worse. Her anxiety got better, because now the
Mhm.
whole world knows how much I've suffered my whole life.
Mhm. Mhm. Mhm.
You know what I mean?
Yep.
But it did bring to the surface fears that none of us have ever had to carry before. And so
Mhm.
exponentially, just the anxiety just doubled and tripled for new moms who were so compromised, emotionally and sleep deprived and so forth. So it's been really hard. I would love to normalize some of that with you
Yeah.
because it's such a big deal.
Hmm.
And there's so much anxiety and fear out there. Pandemic aside,
Hmm.
there's this. So I have to tell you, the one thing I'll just never forget. And when I speak of scary thoughts and our hashtag, Instagram, speak the secret and good moms have scary thoughts. I'm not thinking about the scary thoughts that are really, really scary,
Hmm.
right? And on the continuum of scary thoughts, we know there are god awful, gruesome, violent, scary thoughts. And then there's, oh, what if I forgot her sweater and she gets sick? That's a
Hmm.
scary thought for a mom. So there's a continuum
Hmm.
of a little bit scary, normal scary, more scary, and awful scary. And they're all sort of normal. But I remember my daughter the day she gave birth, and the baby was slightly compromised, and he was preemie and NICU, so he was away from her, and she had a complicated birth and she was exhausted. And this was before we got kicked out of the hospital room. We had one day
Mm.
with her,
Oh.
and I sat with her, and the very first thing she said to me, she says, "Mom," I don't even know if she remembers saying this. She says, "Is it weird? Like, I don't feel like a mother." I'm like, "Baby, it's been 24 hours. Your baby's upstairs.
Hmm.
He's in trouble.
Hmm.
You haven't touched him barely.
Hmm.
You've had this it's complicated birth, and you're lying in bed and you're saying to me you don't feel like a mother. In my business we say duh. Of course you don't. And I sat with her and I thought, wow. And that's the kind of scary thought that I sometimes refer to. It's not like I'm going to hurt my baby, but
Hmm.
moms don't know that these kinds of thoughts are normal, are
Hmm.
common, are expected, are
Hmm.
universal. And
Hmm.
they don't always go away. Even when your
Hmm.
anxiety gets better, we
Hmm.
wonder, am I doing the right thing? Should I be
Right.
doing what she's doing? Wait, why did I say that? I could have said this. Moms are notorious for sort of overthinking, over worrying,
Hmm.
being over vigilant, hyper vigilant about what kind of mom they are.
Hmm.
Sort of, it's well, it goes all the way back to biology,
Oh, sure.
it, you know,
Yeah. Yeah.
and I have to say, I'm often asked, how did you get into this work and why? And I never have had a good answer for that, Kat. And I did not have postpartum depression. I didn't have postpartum anxiety, but of course I had anxiety. But um, I, I think about what happened to me couple weeks ago. I do, because it's just, I had an epiphany because we have a garage that appeals to many birds for some reason,
Okay.
no matter what we do to clean it out. And this one bird, they keep coming back. We have very good real estate in my garage. And this one mourning dove, they keep coming back and having new
Oh.
babies in my garage.
Oh.
And it does something to me that I can't put into words, and I'm a little embarrassed to say it out loud and to use your airspace to talk about my
Okay.
baby birds. But I go out there and I'm like, oh my God. And then I see them sitting and sitting and feeding and sitting and then getting up and then the babies, and I watch them, my breath, I feel it in
Yeah.
my body. I
Yes.
go out there, I'm almost 70. I'm like, good morning. Oh my God. This is why they call it an empty nest syndrome, right?
Uh-huh.
So it dawned on me, I get this physical, compassionate, like, thing that happens, and it's always been with me. And
Mhm.
it's sort of like this work came to me. It
Mhm.
came to me
Mhm.
somehow. I created it, me,
Mhm.
for myself. Like,
Yeah.
what is happening? People aren't talking about this, and I was being exposed to some other work I was doing. Moms aren't feeling good. Wait, why aren't moms feeling good? I grew up in
Mhm.
that generation
Mm,
where
mhm. Mhm.
this is the best time of your life.
Right. Sure.
And
That's a party
I
line.
said, yeah. And I said, I don't think so. Something bad's happening. This isn't what I expected. Was the first book that really, I think, put into words that not all moms feel good.
Yeah.
That it's okay to not feel good as a mom
Yeah.
and still
Absolutely.
be a good mom.
Right.
So I got off topic, as I
No,
did.
No, no, it's
What
all
I
good.
do.
Are you kidding? So many people love you and would be happy to hear whatever you have to say.
Off
Um,
topic. We can just stay off topic. Okay.
for sure. We can have just a whole chat and it'll be all good. Um, but I do want to go back to something you were saying because about kind of the different, if the spectrum, if you will, I guess, of scary thoughts. And I love how you know, would kind of put it into the kind of mild and moderate and severe and intense um,
Mm-hmm.
spectrum because um, it's hard for somebody who's experiencing it to I guess I would say especially if it's new or they're just newly aware that they're having them
Right.
to know what's what. So like can you speak a little bit more to I guess to that range?
Yeah, love to. So one of the things that I said early on was, if I can quote myself correctly here, just a second, let me think. Um, one of the worst parts about postpartum depression is that the feelings don't feel like symptoms. They feel like who you are.
Mhm.
And so what happens is, you know, when you have symptoms of a infection, you know, you have a sore throat and your chest hurts and you can't to swallow and you've got a cold. So you know these are symptoms. I go to the doctor and I say, here are my 6 symptoms. But when you have symptoms of postpartum depression, you have, I should never have had this baby.
Mhm.
I made a big mistake.
Mhm.
I'm never going to feel like myself again. I wish I was, you know, I wish I wasn't here. My partner doesn't understand. These
Mhm.
don't feel like symptoms. They feel like I'm broken. They
Mhm.
feel like something's
Yeah.
wrong with me.
Yeah.
And by the way, that's not just a part of depression. And that's why social media makes me nervous, is because there is such an overlapping diagnostic conundrum
Mhm.
about who's sick, who's not, who's, you know, and who do we need to pay attention to
Mhm.
ASAP. Now, but
Mhm.
back to your original. So there is a continuum of scary thoughts. And how do we know if what I'm feeling is scary, too scary? How do we
Mhm.
know it's scaring the heck out of me? And if I'm afraid, if I say this out loud, I'm going to scare somebody, they're going to take my baby away. That's the
Right.
worst fear.
Right.
They're going to
Right.
think I'm crazy.
Right.
Sorry to use that word, but that's often what we think.
Mhm.
My partner won't believe me.
Yeah.
How do we know what this is? So the best take home point for our discussion here is that we talk about distress. How much distress is this
Mhm.
thought causing you? And suffering is subjective. So what bothers you may not bother me. What
Right.
bothers me may not bother you.
Right.
And distress is defined by the frequency, intensity, and duration.
Mhm.
So all new moms cry. Every new mom cries. Got hormones going on, got sleep deprivation going on, got I'm a
Mhm.
new mother.
Mhm.
But when we take a symptom like that, how much is she crying? How bad is she crying?
Right.
Meaning, how much is it interfering? How long has this been going on? So those three markers equal the level of her distress.
Mhm.
Are you following me?
Mhm.
And her distress tells us how much is it interfering with her ability to get through the day?
Mhm.
How much is it interfering with who she is and how
Mhm.
she usually functions?
Right.
And that's really that's what tells us she may need some more support or professional help.
Right.
Because women are notorious for functioning very well with very high levels of distress.
Yes.
And if she's okay and she's able to do what she needs to do and she's scared and she's worried and she's preoccupied but she's doing, she may or may not want to do anything about it. And sometimes it just gets better on her own. But she needs to know that it doesn't necessarily mean anything bad is happening
Mhm.
unless she's afraid that something bad is happening. And
Mhm.
then her distress is going to be higher. And then she needs to make sure she gets that checked out by a
Yeah.
professional.
That's super important. And I think a really easy rubric, I guess, if you will, for people mm, to think about themselves. It's I think really hard to do a self-assessment sometimes when you're deep, deep in it. Sometimes you only know how bad you felt and when you feel better. But people need this kind of stuff to hold on to just how do I know how bad off I'm feeling or doing, and how do I get help? How do I know when to get help? Um, and I mean, similar to your books, this is just putting information into people's hands is so powerful. So,
And,
so
and
powerful.
and by the way, I actually, and we at the Postpartum Stress Center encourage moms to use the book to go to their healthcare provider who may not have the right training, may not have the expertise, to know exactly, and may women's response typically to what I have to say, speak the secret, tell people, get the help you need, find a safe person. They're like, it doesn't mean anything if the person you tell it to doesn't know what to do with it, or is
Hmm.
frightened by what you're saying, or says, oh my God, you have to go to the ER, or I have to call the police, or
Right.
whatever. There's so much of that out there still.
It's
I
so
just
sad.
can't possibly knock on all those doors. So I'm
Right.
really counting on moms. There are pages in here. In fact, if I had done my homework, I would have prepared better and found the pages. But there are pages here that literally she can say, "This is what I'm feeling.
Yeah.
This is what I need from you."
Hmm. Hmm.
And one of the easiest, quickest fixes that we tell healthcare providers is we don't we don't need you to step into that territory of diagnosing and treating perinatal mood and anxiety disorders. Some people feel comfortable doing that, some don't. But we do need you to hand every single perinatal woman a list of local and internet, what resources
Yeah.
that are reliable, that who they are, that
Yep.
that they come
Yeah.
from a solid foundation. And every woman leaving your office
Hmm.
should have one or two or three or four phone calls, phone numbers, or
Right.
books, or
Right.
websites that they can get the support that they
Yeah.
need.
It doesn't feel like it should be that hard,
I
but
know,
it
don't get
is.
me started. I know.
It is.
Mhm.
Like have an office assistant, just look it up. Anyways, okay, right. That could be a whole other topic.
We could talk about our anger. We could do a whole thing on how enraged we are about
Can
how
we?
long we've been saying this,
Can
right?
we? Yes.
Uh-huh.
Okay. So far, we have about 5 more episodes to do. Just,
Heck,
yep.
I'm ready. Listen, semi-retired. No.
Right. So then, how do people know if they're having, let's say, it, it may be a little bit more easy to tell if you're having one of those really intense, scary thoughts that you yourself are really freaked out by. That I would say people more associate that with intrusive thoughts. When you say intrusive thoughts, it's like they um, are those big things that come in
Yeah.
and scare
Well,
you and all that.
right.
Yeah.
And those typically will be uh, uh, um, related to harm coming to my baby, and something bad is going to happen. And my thinking this almost can feel like magical thinking. If I'm thinking this, maybe it's going to happen. Maybe I'm having some premonition. It can have we can have weapons involved. We can think it's going to be me. The most recent research is that it used to be 91. Now it's like 100% of all new moms experience intrusive thoughts related to harm coming to their babies. This is done by Nicole Fairbrother. And 50% of those moms think it's with intention, and I'm going to do it. So I'm going to take that thing, and I'm going to hurt this baby, and I'm going to be doing it on purpose. What? No, I would never do that. And then that causes this, ego dystonic
Hmm.
anxiety and
Right. That's
panic.
super important. You said they think it's with intention. So the thought is of them doing something, but then they're scared by it and they do not
They're
want to do that.
scared by it, and being afraid of it is sort of diagnostic information for us
Hmm.
because of the anxiety that they're
Hmm.
expressing. It tells us it's inconsistent with who I am. This is not, I would never do anything to hurt my baby, but I keep
Hmm.
seeing this image of me hurting my baby. But I
Hmm.
would, so their distress is what tells us. It doesn't really comfort us, but it helps us understand that this is anxiety driven,
Hmm.
as opposed to a psychotic thought where
Hmm.
it's what we call ego syntonic, and I'm
Right.
not afraid of it because in my distorted reality it actually makes sense to me right now.
Hmm. Right. That is such an important distinction.
So scary.
Oh,
So,
so
yeah.
so yeah. Um, so there's intrusive thoughts that come with OCD, and that the intrusive thought might come with a whole other set of things, the compulsions, sorry, the obsessions and compulsions. But not all intrusive thoughts are OCD related intrusive thoughts.
Right.
Yeah,
Right.
can you
And,
distinguish that for people a little bit?
well, again, that's sort of what we were saying with the distress. You know,
Mhm.
that on the spectrum, if the distress is not interfering with your day, and there's specific criteria that OCD specialists could address that I didn't do my homework with, but it's like how many times a day, how many obsessions a day, how many compulsions a day meet diagnostic criteria of OCD.
Mhm.
So every new mom will go into their baby's room while they're sleeping to make sure that she's breathing.
Mhm.
Everybody does that. You know, we
Mhm.
wake up or we're up anyway, we go
Mhm.
like, oh, look how cute she is or whatever. And we go back, doesn't look like she's breathing. We put our hand on her, belly or her back. Wait, where are they? On their belly or in their back? Where's how are babies sleeping? I
Babies are
forget.
sleeping now on their back.
It's a whole new world, right? Okay. So we put our hand on their belly, make sure they're breathing, we go back to sleep. Maybe we'll do that 2 or 3 times a night. That's
Mhm.
what I would consider within normal anxiety,
Mhm.
parameters.
Mhm.
But a mom with OCD might go in every 15 minutes
Mhm.
or or 4 times an hour, every hour. And the numbers I'm just making up, they're
Mhm.
arbitrary. But it's like I can't sleep because I'm going in so many times. And I'm
Mhm.
exhausted for days because I keep going in and checking the baby. And other people might be noticing that it's interfering. Come and eat. No, I have to go check the baby.
Mhm.
So it's the frequency, intensity, and duration, and
Mhm.
does it meet diagnostic criteria of OCD? And so we need to tease that out. For a long time, we didn't talk about the postpartum anxiety. It was all under postpartum depression,
Mhm. Mhm.
and then OCD now is getting a lot of well-deserved attention for moms who have been suffering for a long time. And a lot of moms, OCD can be present as a feature of having the baby. I've had OCD my whole life, and now I've had a baby. Oh my gosh, we can only imagine what that's like. And some moms have never had OCD
Mhm.
and have a baby and then develop these sort of maladaptive responses to what they think is hypervigilance, again,
Mhm.
biologically triggered by
Mhm.
evolution, right?
Mhm.
Let's take
Mhm.
care of our babies. Don't
Mhm.
let any harm come to our babies, the birdies. You should see me. I'm ready to breastfeed these baby birds, I swear. So there's this a strong
Uh-huh.
thing. It's hard to differentiate from a compulsion, like,
Mhm.
are you okay? Are you okay? Are you okay?
Mhm.
So it takes careful monitoring and attention by both the clinician, the medical provider, the therapist, and
Mhm.
mom. What
Mhm.
is happening? How bad is it? And that's why we say this is the biggest problem, Kat. The biggest problem is that moms aren't telling us how bad they feel. And we get it.
Mhm.
We know why they're not telling us. Not
Right.
everybody knows that, but we know that. People
Right.
who do this work know that they're
Mhm.
terrified for
Mhm.
many reasons, for many justifiable reasons. One is, biggest one, is somebody's not going to know what to do with this information. And
Yeah.
who the hell knows, will things get worse? And they
Right.
might.
Right.
And the other reason that they don't tell us is because it's a shameful, terrible, it doesn't feel consistent with what a new mom should be feeling. And if I don't say it out loud, maybe it will just go away. And
Yeah.
so the fact that they're not telling us means we all, that as part of, the art of holding perinatal women in distress, the core of my work has
Mhm.
now become teaching clinicians how to get in there when she doesn't want us to,
Right.
and how to understand what we call her authentic suffering when
Mhm.
she wants us to think she's fine. You
Right.
know,
Right.
how are you? I'm okay. Are you all right? Yeah. No, no,
Mhm.
no, no. That might be okay for your mother, your sister, your neighbor, and your husband, but
Uh-huh.
not okay with me, right?
Uh-huh. Yeah. Well, actually, I was thinking too, kind of shifting slightly to your book, What About Us, is, people who are experiencing intrusive thoughts, um, often have a hard time talking to their partners or anybody in their family about it because it feels embarrassing or shameful and all that stuff. What are they going to think of me? I live with them. Are they going to think I'm thinking about this all the time? So, right, inevitably it that kind of stuff is going to impact the relationship too, which is, relationship challenges in the postpartum or pretty common because it's hard, super hard. Um, so I think in your What About Us book, you work really hard to kind of normalize and let people see that these challenges happen.
Mhm. Yeah, that's another hour. Are you writing all these down? All the hours that we
Right,
have to
right.
follow up with?
I
So yeah,
know.
what about us is another precious little book that's sort of,
Oh,
can I
please. I would love,
here we
yes.
go. Good moms. What about us?
Hmm.
Um, so what about us? Also has the same format with the illustrations and so forth. And um, what's what's complicated? Let's see if I can do this in a sentence without getting a lot of half the people listening mad at me. I'm old fashioned. I'm old and old fashioned,
Oh my
and
gosh.
so I am a strong believer that. Uh, I'm sorry, I just may upset some people, but I actually believe that women, by and large, are often left with the relational baggage, and that they are better at it. They are the ones that just come here, we have to talk. They are
Hmm.
their
Hmm.
brains are more inclined to do some of that navigating, and men
Hmm.
are a little bit, again, biologically. I'm totally generalizing here, but biological men are a little bit more less inclined to, like, let's talk about our feelings, right? And
Hmm.
so when women are compromised or impaired in some way, and they've shut down, or they're retreating, or they're in a little corner someplace, men are either like, oh, okay, you know, they don't know what to do, or what do I do? Just tell me what to do and I'll do it. I'll do
Right,
it.
right.
I don't want to tell you. I can't breathe right now. I just can't breathe.
Yes,
So
yes.
it causes this conundrum of sort of paralysis in the
Hmm.
in the relationship,
Hmm.
and we get polarized. And now I have to teach you, mom, while you're suffering, how to take care of your marriage. Sort
Yeah.
of. I also hope to tell you, Dad, come on in because
Hmm.
we need some extra help. And yes,
Hmm.
you'll get extra credit for it because it's really, really hard. So even in the best scenarios with no postpartum depression or anxiety,
Hmm.
couples, the relationship is compromised because they're exhausted, and
Yeah.
they're frustrated, and they're angry, and they're tired, and they're being screamed at, and endlessly.
Hmm.
And
By a baby.
that's what I mean by a baby. Sorry, that's what
It's
I
okay.
mean. Thank you for that.
Maybe by a partner, maybe
Thank you
maybe
for
by the
that.
mom. Right.
Right. So it's hard on everybody, but it's really, pay attention to your relationship is is really an important soundbite. And a lot of these folks who are struggling aren't getting the support that they need, either from their family or from their social network or community or culture at large.
Right. Yeah. I mean, as soon as we start talking about all of the impacts, it gets, how can I say it? Like the problem, quote unquote, gets like bigger and bigger and bigger. There's, the person who's
Yeah,
suffering, and then the family, and then the system, and
yeah,
it starts to feel, or can feel, really overwhelming. How am I going to feel better in the middle of all of this
right,
when I have to take care of myself and a baby and now potentially a partner?
right. Yeah,
It's
if
hard.
you're looking for a good answer for that, I don't have it ready with me.
No.
But the best
No.
response that I have to mom who's listening to this is to stay present and to stay focused and to stay connected. The support from her partner is like number one. When
Mhm.
we feel connected to our partner, everything else feels a little bit better. When
True.
this doesn't feel good, everything else feels a little bit flimsier. So and sometimes the better the relationship is, the less we pay attention to it because it's not going anywhere. We think it's
Mhm.
safe to
Mhm.
just move, forward without it, but it's
Mhm.
not true because then weeks and weeks and weeks and weeks
Mhm.
go by, and here we are,
Mhm.
sort of feeling separate from each other. So
For sure. Right. And I would say too, it doesn't have to, you don't have to spend hours and hours every day on the relationship. It can be just like even once a
oh
week, just to say like, I see you, I care about you, and like I'm tripping out right now, so like let's check in next week.
No, thank you for that. That's a really good point. There are, certainly, like, date night, haha, who's had that forever? But there's a check-in, sort of 5 minutes a day, 5 minutes a week, 5 minutes. How are you? You okay? Am I? What do I need?
Mhm. Mhm.
What am I doing that you want me to stop doing, and so forth. But there's also little baby micro things, like you okay,
Mhm.
or a look, or
Mhm.
a peck on the forehead. I mean, that kind of
Right.
stuff can go very far. Stay connected. Just touch, you
Mhm.
know, no
Mhm.
sex, nothing busy like that. We don't want to do all that stuff yet. We just want to pay attention. I know, you should know I'm watching you and I care about you. And there are
Mhm.
very easy ways to communicate that without like sitting down and talking about your feelings.
Mhm. Yeah, for sure. I mean, you also have the postpartum husband. It's a really your book is a great example
It
of all
is
of that.
now the postpartum partner. Do you know that?
Oh, I didn't know.
Yes, we're trying to stay relevant. See, oh, sorry. So this
No, no.
is the original book, and then we
Mhm.
just updated it.
Oh, very
So
exciting.
yeah, so we updated it, and it's the same book with the same information,
Mhm.
but we just wanted to be more inclusive for couples. And
Yeah, for sure.
it's
Well,
a
that's
it's a
very
really
exciting.
good resource for folks who don't want to sit down and read a book. Like Good Moms, it's sort of
Mhm.
easy. It compartmentalizes everything in a
For sure.
digestible way that makes it,
Yeah.
sit down and read a book.
Yeah, for sure. It does. Well, I think, I feel like we've only just brushed the very surface of
We
all that
need
you
3 or 4
do.
more hours right
Oh,
now.
okay. I've got time.
All right, let's go.
No, seriously, I'm happy to have you back anytime for any reason. I love talking to you. I love the work that you do and how many people you've helped. And I know that for the folks listening are going to be so excited to hear from you.
Thank you, Kat. I love seeing you too and talking with you.
Well,
And the work
apparently,
that you do. Can we
oh,
talk about how fabulous you are just for a
oh my
second?
gosh.
This is
Here,
amazing what you do.
you can save that for when you interview me.
Okay, got that. That's a deal.
Anyhow, I thank you for the kind words and
Thank
for
you.
your time. I know how precious it is, and appreciate you spending some of it with us.
Absolutely. Thanks for having me.
Thank you again, Karen, for coming on. Anyone who wants to find out more about Karen and her trainings can go to postpartumstress.com. And moms can find support from the Postpartum Stress Center on Facebook, Twitter, and Instagram, which includes their hashtag Speak the Secret campaign that busts the stigma of perinatal intrusive thoughts. Please do share this episode with anyone who you think could benefit from understanding more about intrusive thoughts, which, by the way, is everyone. Thank you so much for being with us. Until next time.